Catherine Isaac has always been active, but when she got sick with COVID in 2021, she couldn't even make it up the stairs without being out of breath. Isaac went to a nearby hospital and ended up in the ICU.
I realized my arm was becoming harder and harder to control. I couldn't lift it, I couldn't grip a fork, and after about a week, I think they determined that, I had had a stroke.
The physical recovery was hard enough, but it also took a toll on Isaac's mental health.
So I had a couple of very, very public breakdowns.
The latest data from the Heart and Stroke Foundation suggests nearly 1 million Canadians are living with health impacts after a stroke. The condition happens when blood stops flowing to any part of the brain, damaging or killing brain cells. It can lead to death or brain damage, long-term disability, and mental health impacts.
Between 30 and 60% of people after a stroke suffer from depression and anxiety, and the vast majority would be women. This is a comparison of a brain of a person who's had multiple strokes.
This leading Toronto physician says those mental health issues can be among the hardest parts of someone's recovery, and it's not fully clear why women fare worse.
Unfortunately, where women get the burden and less resources available.
Medical experts say more post-stroke mental health support is crucial.
I think we have to realize that a lot of care now has to be multidisciplinary.
Isaac has built her own support network, and every week she types out motivational messages to boost her own mental health. But getting to this point wasn't easy. She says having a social worker visit patients in hospital could connect them to resources for when they get back home.
There's so many of these people going through the same thing, and some people just get stuck in it, and they need more help to get out of it.
So how do you spot someone having a stroke? Well, just remember the word fast. Face drooping, arm weakness, speech difficulty. Then it's time to call 911. Lauren Pelly, CBC News, Toronto.